Tolmetin, detailed drug monograph. Generic name, drug class, brand name, drug forms. Generic name, Tolmetin, Tolmetin sodium. Drug class, nonsteroidal anti-inflammatory drug, NSAID. Brand names, Tolmetin, Tolmetin DS, Tolmetin 600. Brand availability varies, generics exist. Forms, oral tablets and capsules, standard and double-strength formulations. Definition. Tolmetin is an oral NSAID used to relieve pain, swelling, stiffness, and inflammation in arthritis and related musculoskeletal conditions. It is for symptomatic relief only, not disease-modifying. 3. Mechanism of action. Reversibly inhibits cyclooxygenase, COX-1 and COX-2 enzymes. This reduces prostaglandin synthesis, lowering inflammation, pain, and fever. Symptom improvement is often noticeable within a week, though full effect may take longer. 4. Uses rheumatoid arthritis, osteoarthritis, juvenile idiopathic rheumatoid arthritis, other musculoskeletal or inflammatory pain where NSAID therapy is appropriate. 5. Indications. Long-term symptomatic management of osteoarthritis and rheumatoid arthritis. Pediatric indication. Management of juvenile idiopathic arthritis in children in 2 years. 6. Contraindications. Known hypersensitivity to Tolmetin or other NSAIDs. History of aspirin-induced asthma, urticaria or allergic reactions, active GI bleeding, peptic ulcer or perforation, use for perioperative pain in CIBG surgery, severe renal or hepatic impairment. 7. Precautions. Before taking. GI risks, prior ulcer, bleeding, or using anticoagulant steroids, higher risk of GI bleed. Cardiovascular risks, heart disease, hypertension, heart failure, or stroke history, higher risk of events. Renal impairment. Monitor kidney function, especially if also on diuretics, ACE inhibitors, ARBs. Liver impairment, rare liver injury reported, monitor for jaundice or abnormal labs. Pregnancy, avoid in 3rd trimester, ductus arteriosus closure risk. Elderly, greater risk of GI and renal complications. 8. How to use. Take orally with water at the same time each day. Can be taken with food or milk to reduce stomach upset. Do not crush extended release tablets. Avoid alcohol while taking due to increased risk of GI irritation and bleeding. 9. Dosing information. Adults, osteoarthritis, rheumatoid arthritis. Start, 400 milligrams orally 3 times daily. Maintenance, 600 to 1,800 milligrams a day divided into 3 to 4 doses. Maximum 1,800 milligrams per day. Children 3 to 2 years, juvenile arthritis, 20 milligrams per kilogram a day, divided in 3 to 4 doses, may increase up to 30 milligrams kilogram per day under medical supervision. Renal hepatic impairment, use cautiously, consider dose reduction, and monitor closely. 10. Misdose and overdose. Misdose. Take as soon as remembered unless near the next dose. Do not double up. Overdose signs, nausea, vomiting, stomach pain, drowsiness, dizziness, difficulty breathing, seizures. Requires emergency care. Treatment is supportive. Camashat 11. When to stop or avoid. Stop Tolmetin and seek care if black tarry stools or vomiting blood, chest pain, shortness of breath, weakness on one side, possible heart attack or stroke, swelling, rapid weight gain, little no urine, severe allergic reaction, rash, swelling, breathing difficulty, jaundice, dark urine, unexplained fatigue. Chart 12. Side effects, common, nausea, vomiting, diarrhea, stomach upset, headache, dizziness, drowsiness, indigestion. Serious, GI bleeding, ulcers, perforation. Heart attack, stroke, hypertension. Kidney injury, fluid retention, edema. Liver injury, rare but can be severe. Allergic reactions, asthma attacks in sensitive individuals. 13. Vital information. Use the lowest effective dose for the shortest duration possible. Long-term use raises risk of GI bleeding and cardiovascular events. Monitoring kidney function, liver function, blood pressure, and blood counts in long-term therapy. Not recommended in late pregnancy, caution in elderly. NASDAR 14. Drug interactions. Other N-aspirin, GI and cardiovascular risks, anticoagulants, warfarin, antiplatelets, clopidogrel, bleeding risk. Corticosteroids, ulcer, bleeding risk. SSRIs, GI bleeding risk. ACE inhibitors, ARBs, diuretics, risk of kidney injury, fluid retention. Lithium levels, toxicity. Methotrexate, digoxin, toxicity risk. Summary. Tolmetin is an NSAID used mainly for arthritis. It's effective for pain and inflammation, but carries important risks: GI bleed, heart attack, stroke, kidney liver injury. Always use the lowest effective dose, monitor closely, and avoid in high-risk patients unless necessary. Thank you. Have a nice day.